Carpal tunnel syndrome is quite prevalent in pregnant women. The carpal tunnel is a little tunnel in the wrist. So we have three sides formed by wrist bones, and then you have ligament over the top. Your median nerve is the nerve that passes through this tunnel. And often during pregnancy, women retain some fluid, they get a bit of swelling in this area, and it can cause pressure on the nerve as it passes through this little tunnel. Typical symptoms of carpal tunnel include a burning feeling, tingling feeling into the hands, often in the morning time. The median nerve supplies the sensation to the thumb, the index finger, the third finger, and half of the fourth finger. So you can get this tingling feeling. It's very distinctive in those fingers. It can also affect the muscle that it controls in the base of the thumb. So typically you may feel it in the morning time, particularly if you tend to sleep with your wrists slightly bent. So usually it will shake out quite easily, but if you're getting it every day, it's something that you need to deal with because it can get worse as the pregnancy progresses. Also, what can happen with it is that you can start to get a weakness, not just in the hand and wrist, but up through the arm and up into your shoulder. So again, it's important that you deal with it quickly. When you're working, if you work with sort of repeated forceful hand movements, typing, if you're at a desk, that type of thing can aggravate this. So again, you might need to speak to your chartered physiotherapist about wearing a wrist brace, which will keep you in a nice neutral position, prevent this bending through the wrist, which can put further pressure through your median nerve. So your chartered physio can advise you on that. Ice is usually very good for relieving the symptoms of it. If you just rub an ice cube on it, it's very good for dealing with nerve pain. So you'd rub it over the fingers, you'd rub it over the wrist area. That can make a really big difference. Your position in the bed at night will also make a difference. So you might need help just rearranging pillows to try and make sure that your arm is in the correct position. And again, the wrist splint to keep you in neutral is sometimes very good to wear at night.